the structures which are opening in the right atrium or the right atrial cavity are the three veins, because the veins are bringing deoxygenated blood back towards the heart, and the right atrium, or the right side, in fact the right side of the heart, is carrying deoxygenated blood, as I have mentioned it previously as well. So the right atrium is the receiving chamber. It is going to receive the openings of the three veins. Two of these veins are bringing deoxygenated blood from the entire body, and one venous structure is bringing the deoxygenated blood from the heart musculature itself. Okay, so let's have a look. So this is the cavity of the right atrium. As you can see here, the structure which is opening from below, from the inferior surface of the right atrium, the inferior vena cava is opening, and the inferior vena cava is bringing deoxygenated blood from the body below the diaphragm. So that includes the lower limbs, the pelvis, perineum, the abdominal structures. Everything which is below the level of the diaphragm has been drained off by this large vein, the inferior vena cava. Then this structure is the superior vena cava. Just like the inferior vena cava, everything above the diaphragm has been drained off by the superior vena cava. That includes the head, brain, the neck, the face, the upper limbs, the thoracic or the chest cavity. Everything has been drained off by this superior vena cava. So the superior vena cava is opening up at the roof, within the roof of the right atrium. The inferior vena cava is opening within the floor of the right atrium. Okay, what about the third venous structure? That is, I believe you're able to see that just beside, like slightly towards the left side of the opening of the inferior vena cava, we do have an opening, that red colored opening, that is the opening of the coronary sinus. This is a large vein because it is coronary, so it is a vein which is carrying deoxygenated blood from the heart itself. The myocardium has been drained off by the coronary sinus into the right atrial cavity. Okay, so if I show you, so this is the opening of the coronary sinus, which is lying just beside the tricuspid valve or the right AV valve, and the opening of the inferior vena cava is the opening of the coronary sinus. And if I show you where is the coronary sinus, I can flip it and show it to you. It's pretty much visible here at the back. So the coronary sinus is opening up into the cavity of the right atrium. Three veins, superior vena cava draining the upper body, inferior vena cava draining the lower body, and the coronary sinus draining the myocardium itself. Then after receiving these veins, the venous blood is being pulled into the right atrial cavity, and similarly the left atrial cavity has been filled up by the oxygenated blood that has been coming back from the pulmonary circuit, from the lungs. So here is the cavity of the left atrium, the smooth cavity, and you can see, because I told you that the left atrium is the posterior-most chamber of the heart, and it is also known as the base or the posterior surface of the heart. Okay, so if I flip the posterior surface and show it to you, these are the four pulmonary veins, two emerging from each lungs, ideally. But sometimes, in some cases, there is an evidence of having three pulmonary veins. But in general, like up to 80% of population, there are two pulmonary veins from each lung, and that makes the four opening into the cavity of the left atrium. So the oxygenated blood is getting collected into the left atrium. Now, before talking about the circulation or the passage of blood within the ventricular cavities, let's talk about the ventricles. So I showed you the anterior wall of the ventricles, and I talked about the trabeculae carnae. The trabeculae carnae are the muscular ridges or fleshy bars of myocardium, which are, you know, engraving the walls of both the ventricles from inside. On this model, you can appreciate that there is a marked difference between the thickness of the right ventricular wall and the left ventricular wall. The left ventricular wall is 3 times thicker than the right ventricular wall. And I have mentioned that the function of the left ventricle is to pump blood into the systemic circuit. So it requires a lot of power, and that's why its walls are like lined with the huge number of myocardial cells. Okay? Now, before moving on to the valves, the AV valves or atrioventricular valves, I also have to talk about the interventricular septum. So as you can see, the interventricular septum is also made out of the muscle fibers. It's the myocardium. The same myocardial cells are making the fleshy interventricular septum. And we have to keep this idea in our mind that the ventricular cavities and the atrial cavities have to be separated from each other. Like the right half is to be completely separated from the left half. So the right ventricle has no connection with the left ventricle whatsoever. Okay? The upper part of the interventricular septum is membranous. Embryonically, developmentally, it is being developed from a different source. So the lower two-third of the interventricular septum is muscular, while the upper one-third, which is closer to the AV valves, is made out of specialized connective tissue which is present in the heart cavity, and that is known as that is the membranous part of the interventricular septum. Why I'm stressing upon this point, that the reason is, like most of the congenital malformations related to the heart, they have some evidence in the membranous part of the interventricular septum. So if you must have heard about this term that there is a baby is born with a hole in the heart. So that hole in the heart is usually interventricular, a defect in the interventricular septum. Which part of the interventricular septum is mostly affected in 90% of cases? It's not the muscular two-third. It's the upper one-third that is being formed by a membrane. So there is a hole, or there is a gap within that membrane. So the right and the left ventricular cavities will be communicating with each other, which is not normal at all. Okay? Now, if I take a cut section, a cross section through the two ventricles of this model, and then show it to you on the board. So here it is. You can see the cavity of the left ventricle is almost rounded. The wall is much thicker and the cavity is rounded. Why? Because this interatrial, this dark black colored structure is representing the interventricular septum. It's the interventricular septum, which is bulging within or into the right ventricular cavity. So the right ventricular cavity on a cross section will appear as a crescent, or it's like semicircular, half moon shaped, while the left ventricular cavity is almost perfectly round. Before moving on to the valves, we have to talk about the doors. So the ventricles, if I ask you to consider the ventricles as two rooms, completely separated from each other, but they have each room, like the right ventricle and the left ventricle, they have two doors. A door that is for entry and a door that is for exit. So let's explore. Like, this is the right ventricular cavity. There is an entry door that is known as the atrioventricular valve. This entry door is for the entrance or entry of blood, deoxygenated blood, into the right ventricular cavity. Okay? Then there is a guard at this door. So we'll talk about the guard. The guards are known as the valves. Okay? So this door is for entry of blood. Then once the blood is inside the ventricle, it has to be pumped out. It has to be pushed out into the pulmonary circulation from the right ventricle, into the systemic circulation from the left ventricle. So the exit door of right ventricle is this one. So this is the door or the opening that is lying between the right ventricular cavity and the pulmonary trunk, which is one of the great vessels. Okay, so the pulmonary trunk, pulmonos means lungs, the pulmonary trunk that is going to be divided into the right and the left pulmonary arteries, because by definition the artery is carrying blood away from the heart. So the deoxygenated blood will be supplied to the lungs through this pump or through this trunk. Okay, so the right ventricle has an entry door that is known as a right AV valve between the right atrium and the right ventricle. Then an exit door that is known as the pulmonic valve or pulmonary valve, pulmonary semilunar valve, that is between the right ventricular cavity and the pulmonary trunk. The right ventricle, as you can see, it's almost riding over the septum. You can see that this portion, there's a smooth funnel-shaped portion of the right ventricular cavity is known as the infundibulum. Infundibulum means a funnel. So this is a funnel-shaped smooth, slope that is heading towards the exit door. That means the blood will flow on this smooth surface of infundibulum and will enter, after opening of the valves, it will be entering into the pulmonary trunk from the right ventricle during the systole phase. Okay, now let's talk about the left ventricle, explore it. The left ventricular cavity is much larger because of the bulging of the interventricular septum towards the right side. The left ventricular cavity is pretty much large, you can see. But the wall is much thicker, the reason I just have mentioned. And here you can see the entry door is the left AV valve, that is known as the bicuspid valve. The right AV valve is known as the tricuspid valve, while the left AV valve is the bicuspid valve. So the entry door is between the left atrium and the left ventricle, while the exit door is slightly like spiraled, it's twisted. So the exit door of the left ventricle is this one. That door is heading towards the aorta, the largest artery of the body. So the blood has been pumped down from the left atrium into the left ventricle through this entry door, that is the bicuspid valve or the left AV valve, and will be pumped out of the ventricle, out of the heart, into the aorta for the supply through this aortic valve. So we have two exit doors. The exit door in the right ventricle is known as the pulmonary valve or pulmonic valve, while the exit door of the left ventricle is known as the aortic semilunar valve. Okay, let's talk about these AV valves, the valves between the atrium and the ventricle. Here you can see that these are the valves or the AV valves which have cusps. So they are like parachutes. So I want you to imagine a parachute that when it is like it's open. So the flap, the smooth convex flap, is towards the right atrial cavity. Okay, while the base or the bottom of these flaps, so the door between the right atrium and the right ventricle is guarded by these three cusps. It's been guarded by three flaps. So there are three cusps, so we call them, this valve or this door is known as the tricuspid valve. Okay, so the convex ballooned up parts or flat surfaces of the valve, the tricuspid valve, are facing the atrial cavity, right atrial cavity, and the lower surface of, or the concave surface of the cusps, all three cusps, are having cord-like structures. They are like threads, stretchable threads, and they're known as chordae tendineae. Chordae tendineae, chordae tendineae. They are tendinous cords. So we have these thread-like structures. These threads or chordae tendineae, have been anchored into the tips of these muscular projections. And these projections are present within the ventricle, within, like, we are talking about the right side of the heart, so I'm showing you the right ventricle. So the right ventricle, because the right AV valve has 3 cusps, so the right ventricular cavity will be having 3 papillary muscles. So these are the mounds of myocardium which emerge from the base, from the floor of the right ventricle, and they are projecting into the cavity towards the atrium like fingers. So the tips of these papillary muscles, so we have papillary muscles. We have 3 papillary muscles on the right side. At the tips of these papillary muscles, the chordae tendineae are anchored. So every time when the ventricle is contracting, it's ready to be contracted during the systole, these muscles will contract first along with the walls of the ventricles. They will contract and they are going to stretch these chordae tendineae. And these chordae tendineae are like, you know, strings of a puppet. The puppets are the cusps. So that these cusps will be approximating each other, and by doing so they are going to close the door. They are going to close the door between the right atrium and the right ventricle, so that making it sure that there will be no regurgitation of blood back into the right atrium. I want you to understand this concept, this phenomenon, that the healthy AV valves, or the entry doors to the ventricles, they are healthy, so they approximate, they completely close down during the systole phase. So when the 2 ventricles are contracting, there will be no regurgitation or backflow of blood into the atria. Now on the left side we have the bicuspid valve. The bicuspid valve, the name is telling you that there are 2 parachutes. There are 2 cusps instead of 3. Imagine my hands are representing the 2 the cusps of the bicuspid valve. So the anterior cusp is larger than the posterior cusp. So it gives an appearance of it is also known as a mitral valve, because it gives an appearance of a hat that a priest wears at times in church. So we call it the mitral valve. Okay, it's pointed. So you can see that there are 2 papillary muscles instead of 3 in the left ventricle, because the left AV valve is bicuspid or mitral valve. So there are just 2 papillary muscles which are having the chordae tendineae anchored into their tips. And every time during the systole, just like the right ventricle, in the left ventricle, there will be contraction of these papillary muscles, tension in the chordae tendineae, and they are going to close the 2 cusps. They are going to approximate the tricuspid and bicuspid valves, so there will be no backflow of blood into the atrial cavity during the phase of systole. Let's talk about the exit doors. So you can see on this model, there are, just like the valves between the atria and ventricles, there are valves, or there are guards sitting at the door between the ventricular cavity and the vascular cavity. Okay, so here in front of you is these 3 small swellings which are guarding. They are the semilunar valves, or the pulmonary valve. They are guarding the opening to the pulmonary trunk. And then here you can see there's the aortic valve. Again, it is having 3 cusps. Okay, and why they're known as the semilunar? It has something to do with the shape. Okay, here you can see, like what I have sketched here is just the left ventricular cavity. As you can see that the wall of the ventricle is much thicker, so it must be the left ventricle. So the same thing is happening on both sides, in both ventricles, but I have focused on the left ventricle to show you. So this is the emerging vessel from the left ventricle, that is the aorta. And if I cut open the aorta and I open up, like I just like the aorta is like a tube. I just made a cut section through the aorta in the middle, and I have opened it up for you. Here you can see the aorta is opened up, and these are the three cusps, right? So it is something like this. So imagine my fingers are the three flaps of the semilunar valve. So there is an anterior and two posterior, okay, like this. So when you open them up, when you open up the vessel, you will be able to see these three flaps like this. Okay, so first of all, notice the shape and notice the absence of chordae tendineae. Okay, there are no chordae tendineae. You can see here they look like half moon. They look like small cups, right? So what happens when the blood gushes at the beginning of the systole? When the blood gushes out of the ventricle, left ventricle, it is getting into the aorta. These valves or these flaps are open, the exit door is wide open, and the blood is gushing into the aorta. Then once a level has been reached, the pressure has been raised in the aorta. I'm not talking about the pressures right now. That is a little bit more detailed. So I just want you to have this concept that there is a threshold. The pressure threshold is playing the main role in the systole and diastole phases, right? So at the end of systole, when the pressure in the left ventricle has been dropped and the pressure in the aorta, the same thing happens with the right side. The pressure in the right ventricle is dropped and pressure in the pulmonary trunk. So pressure within the great vessels has been increased, has been raised. That will lead to the closure of these semilunar valves. So they will be closed like this. And although the pressure in the left and right ventricles is much lower than the vessels, but because of the framework of these valves, these pocket-like, like cup-like valves, there will be no backflow of blood at the end of the systole. So once the blood has entered the vessels, the valves, the semilunar valves, make sure, because of their architecture, they are capable of preventing the backflow of blood into the ventricular cavity. Although the ventricular pressure is much lower and the vascular pressure is much higher, but because of the presence of these specialized valves, there will be no backflow from the high pressure zone to the low pressure zone, which is usually common in physics, right? So that is not happening. The architecture or the structure of the AV valves and the semilunar valves have to be understood very clearly. The AV valves are opening in a downward direction during the phase of diastole, during the phase of ventricular filling. The entry doors will open down. Blood will trickle down. It will gush down from the atria to the ventricles. Then, as the ventricular pressure will be rising, there will be closure of the AV valves. So the exit doors on both sides will be blocked. They will be closed completely. The healthy valves have to behave that way.